Malawi is one of the countries in sub-Saharan Africa. We have a population of 17 million.
We have the highest prematurity rate in the world. Up to 18% of our births will be premature babies. If you are born with a birth weight of less than 1,000 grams, the chances are 1 in 10 of those babies will survive.
Almost half of our babies now, of our children, are dying within the first 4 weeks of life. So we thought, why can't we just target the first 4 weeks of life and see whether if you come up with an integrated package at the level of a hospital, whether you'll be able to improve outcomes in terms of deaths, but also their quality of life.
Neonates, which are children in their first month of life, often required, for instance, if a newborn develops difficulty breathing, is support that can only be given at the facility level.
We are looking at effective interventions that are proven. This includes continuous positive airway pressure device.
When you're dealing with small and sick babies, one of the commonest problems you deal with is breathing problems. Tiny babies, their air sacs are closed. So what this machine does, pushes air into the lungs, keeping the airways open.
And that's been shown to reduce mortality perhaps 27% or more.
And then also we are looking at how health workers and mothers implement what we call kangaroo mother care.
So the mothers nurse their babies skin to skin, improving survival for these babies.
It helps with a lot of things, including temperature stability for children who are particularly vulnerable. One of the things we've learned is that there really needs to be ongoing and sustained mentorship provided to healthcare providers that are using these technologies that they hadn't used before. One of the things that's being used increasingly in many settings, including in Malawi, is mobile health or mobile phones, for instance, using a platform such as WhatsApp to help with the training as well, for people to pose questions that could then be addressed in real time.
Through this, we have training of the healthcare workers, but also of the mothers and carers, providing capacity building for the staff in the district hospitals, and then provision of continuous mentorship to the staff. Over time, we learned lessons in terms of how to collaborate, how to structure our interactions, and how to make optimal use of each person's strength.
Our baseline evaluation of the facilities, that allowed us to identify some of the gaps that were more in need of filling. Infection control was identified as one of the areas that there was really need for support.
We have a program at the moment being championed by the Minister of Health. We call it the Newborn Essential Solutions and Technology Program. Some of the approaches are coming from our IMCHA project.
Our results are already quickly being fed to ministry, where the standardization of care is formulated.
So at least 90% of our pregnant women deliver in the hospitals. So they've moved from delivering at home, they're coming to us. And we've seen the impact on survival.